The doctor-patient relationship is based on trust. Trust is at the core of that relationship.
One of the most important things that when I train medical students and residents is I teach them to sit down with the patients, make good eye contact, not to be on a computer with their back to the patient, but to look at them and give the patient time. The most important thing about being a doctor is to be a good listener, show respect, show empathy and compassion.
Patients come and really open their souls and their hearts to their physicians, and physicians really respect that. And when a patient is honest with their physician because they have a very trusting relationship there, it makes it where the physician can provide the best care and the best advice for that individual patient.
So it's something that, from the moment that you begin training to become a doctor, it's made very clear and apparent to you that, people are going to place their trust in you. They're placing their lives in your hands, and so you have to take that very serious, and it has to, really be the most important thing to you is taking good care of your people, being honest and direct with them, and being someone that they can rely on.
For me, it's I've been doing this for over 20 years, and I feel like sometimes I became part of the family, and I feel like patients trust me, I know them, and we walk through different phases of life together. And I feel like that's very important in their health, in making the right decisions of where to go, what to do next, when problems arise, or just, daily things they go through.
I had somebody a few weeks ago who really didn't want a flu shot, and I talked to him a little bit about it, and then he said, "Well, did you get it?" And I said, "Yes." He said, "Okay, I'll get it because I trust you."
It's certainly essential to maintain that trust between the physician and the patient, so the patient feel like they can come in and they can express themselves and they can tell you really anything, and that way you can help learn about them and who they are, so that you can provide the best care possible to that patient.
So I tell my patients all the time that I can't make you well on my own. It's a team effort and something that we have to work together on. And I think that resonates well with patients.
So as a family physician, I find that probably the most important thing is that the patient actually have a relationship with the physician and trust that physician. We're both in this together. I'm not here to tell anybody what to do. I'm here to give advice and to teach and to really tell you what I think the best option is.
It's important to the patient because they need to be able to trust their doctor. They'll be able to trust their doctor that he or she is going to do the right thing for them and has their best interest at heart.
We always want what's best for our patients. We always want you to trust us, and we always want our relationship, the doctor-patient relationship, to be something that's honored, something that's valued, and something that is a positive impact in your life.